York's classic rock, Q1043.
Good morning, and we welcome Dr. Waleed Javaid. He is a hospital epidemiologist, actually director of infection prevention and control at Mount Sinai, and also a professor of medicine at the Icahn School of Medicine at Mount Sinai. And the reason I asked Dr. Javaid to join us this morning is because of the growing concerns over the Delta variant of COVID. And I understand, Dr. Javid, just heading into this, that there are so many unknowns. So I'm just going to rattle off all these questions. And I know you may not have the answers, but first of all, how serious is the Delta variant of COVID? How much should we be concerned about this?
So as with everything during this pandemic, we are seeing everything for the first time, including the Delta variant. It is very much like the original virus, but it does seem to spread more easily and more effectively, and probably infecting more people. There's some reports saying that it might cause more severe illness, but that has not been substantiated. The issue really is like think of it as if the other variant, one person could infect two, this might be infecting three. Now, we don't have exact numbers, but there is increasing number of people that get infected. With that, when we have more and more people infected, we will have more people proportionally who have severe illness. So it definitely, we will see uptake in the more of severe illnesses. But the important thing here really is that people who are vaccinated for the original virus, for initially we all got vaccinated earlier this year, those people are not getting admitted to the hospitals or having any worse consequences of the illness, including death or disability. If you are already vaccinated, if you're not, if people who are not vaccinated, we do see a lot more illness in that group of people.
I had heard, and this wasn't substantiated as far as I know, that this form of COVID is not only transmissible inside, but also outside. Is that correct or not correct? Or is it an unknown?
It's. I would say it's unknown. I have no reason to believe that it is more transmissible outdoors versus indoors.
No, not more, just that you can get it outdoors, because we were told before with the previous COVID strains that we were pretty much safe outdoors.
Yeah, I would say we were. I wouldn't think we were ever pretty much safe outdoors. But it's relative risk. So risk of outdoor infection would be exceedingly low. Nothing during this time is pretty much zero. We really don't have technology to detect that much of a detail. But the outdoor, with the wind, with air movements and all that, the risk of transmission is low. There is no reason to believe this is any different, but then again, we are learning more and more new things about this. So more to come.
And we just learned this week, according to one study, that the Johnson and Johnson vaccine is not as effective in preventing the Delta variant as the other two, and that a booster may be needed if you had the J&J. What are you learning about this, Dr. Javid?
So thank you so much for bringing up the question about boosters. At this time, there is no reason to believe that we need boosters. The only reason to get boosters would really be if the illness is completely not covered. With the illness is not illness severity remains persistent or worsens because of the virus itself, which we have not really seen, or if our immunity has gone down to a point that we become susceptible. So as I said earlier, that people who've been vaccinated, Pfizer, Moderna, or even Johnson and Johnson, are not getting more severe of the illness. Now, the caveat here is that people can still get infected even after vaccination. The majority of times, and what we see in majority of times, they think either it's their allergies, its symptoms are so mild, you just are sneezing for a few days and you're fine, or it's almost like very mild common cold. Majority of people have very, very, very mild symptoms. So with all the vaccines, so at this time, there's no reason, there's no technical information that we have seen that suggests that the Johnson and Johnson vaccine efficacy is lowered in those cases. Could it be that in future, in a few months, once we have a little bit more data, that there is some suggestion of doing that? Possibly, but I don't see it happening. At least the data, the information, the technical details of human immune system response to the vaccination seems like the memory, the our memory to the virus, the original virus is pretty good, and it will remain there for extended period of time. Now, that said, sometimes our body forgets. We just don't know when it will happen. We're looking at it, but at this time, even most recent data doesn't suggest that we should get boosters.
I have seen estimates all over the place. I
Yeah,
have seen estimates that the vaccine will protect you for 6 months. Then I saw that it could protect you for 12 months. Then I saw that it could protect you possibly for years. I think what is concerning to people is the unknown. So, at what point? Are we going to wait until this is rampant before they say, oh, and now you need a booster? I think, it's frustrating. I understand that for the medical community because this is something we haven't seen before. But you understand the frustration in civilians because everyone's just trying to figure this out and do the right thing and make sure that your family stays safe.
absolutely. I think it's so much important to recognize that we are frustrated, we are confused, and that's really the reality. That there's a lot of information out there, a lot of opinions out there, including from some experts or so-called experts as well. We simply do not know a lot of details, but I'll give you a couple of examples. For example, polio. How many cases have we seen recently of polio? None in US because of the vaccination itself and it works. But if I bring 30% of people with polio into a US population, we might start seeing more and more cases. So there's a time when we will achieve eradication, but we haven't achieved eradication at this time. I'll give you another example. Measles. A few years ago, we had this measles scare. All of us are vaccinated for measles, or majority of Americans are. But there was always the thought of should we give a booster or not? Because at one point, our immune system doesn't mount enough response to the virus that is required. But most of the time, what vaccine still does, and even with measles, the vaccine was still doing, was that even the vaccinated individuals would not get the most severe illness. And that's really where the bottom line for the COVID vaccine today is that 99%, 98% to 99% of people who are getting admitted to the hospital with COVID or with COVID complications, or even if they're dying, they are unvaccinated. Vaccinated people staying out of the hospital. How, that the confusion, the data, the information that's out there is based on a lot of guesswork. But I think following some specific scientific data from CDC, from WHO, is going to be helpful. I know confusion has occurred because some of the companies have said that they're developing booster vaccines and so on and so forth. There is still a lot that we need to learn. So I think what all of us we could do is to take a step back and just take a pause, get the vaccine, and literally see how the information flows to us. Be selective in what we share, what we take in, and then also give ourselves a little bit break. Not After getting vaccinated, you are pretty much safe from a lot of badness. So give yourself a break, congratulate yourself, take it easy. I don't think we need to jump to another booster, at least for next month or so. I don't see any data that suggests that. And or forever. I do not know if we will need it or not, but I think people who are vaccinated can pretty much relax substantially more than they were, for example, in December before getting vaccinated.
I'm speaking with Dr. Waleed Javaid. He is the director of infection prevention and control at Mount Sinai, also a professor of medicine at the Icahn School of Medicine at Mount Sinai. What are you seeing in terms of the Delta variant at Mount Sinai?
So I cannot technically I don't have updated numbers from our labs or information, but what we see is what I will quote what CDC has said initially, and even earlier today or yesterday, Dr. Fauci said the same thing. Above 80% of the cases that we see are Delta variants, uh, and uh, and this is across the country. So I don't see that Mount Sinai would be any different. The main thing really about that is that we call it Delta variant. The viruses will have other variants as well. Before this, we had the UK variant, if you remember, then the New York variant, the California variant, and so on and so forth. So the main thing really is coming down to a point of coming down to a point of we might actually see another variant, gamma variant, or another variant coming our way. I think those are just scientific names. The virus will continue to evolve, and the more fittest virus will survive. So that the virus that spreads easily, that's what we will see surviving more and more. And we are seeing more of this because especially because internationally vaccinations are not as much, so there's a lot of chance for the virus to evolve. Not to blame anyone or not, it is the fact of how the evolution of this virus is occurring. So I think once we see an uptake in vaccinations across the world, it will help relieve us from this. But I don't think Delta virus is the last variant that we will see.
Do you think we need a masking indoors mandate again?
So I think we need to think about things smartly, right? So the CDC does suggest that you don't have to mask indoors or outdoors if you're vaccinated, and for variety of majority purposes, it's fine. But if you're going in a gathering, you're concerned, just wear a mask. If you are in presence of people that you know might not be vaccinated, and just mask. Please do not interact with people or excuse yourself from interacting from people who might be symptomatic, who you obviously see are having symptoms. Even if they say allergies, I don't I don't know if I can make a clinical differentiation between allergy symptoms and COVID, especially after getting vaccinated. So I think it's important to protect yourselves to be vigilant.
Okay, one last question, and we only have a minute. I saw a shocking survey. I think it was a YouGov survey. 1 in 5 Americans think that in that vaccine is an implant, a chip implant. I mean, I can't even wrap my head around that. 1 in 5.
Yeah, and that's the amazing part of the misinformation we are in. I tell people that after I got vaccinated, my IQ jumped like 40 points. So there's probably because of the chip, but but in all seriousness, right? There is this is less than zero point 0.5 ml of fluid that goes in our body. There is no chip or anything. My family, my loved ones, everybody, I gave this vaccine because this is our hope against a pandemic. We as a country, we as a nation, but we also as humanity, at least in our recent memory, in a century or even longer than that, have not seen a pandemic like this. We have to trust science. We have to move forward. We will all make mistakes together, but being skeptic and taking a step back is the wrong move here, right? So there are the chances of getting infected or having any bad outcomes after getting vaccine are are fairly low. The chances of dying after getting vaccinated and dying of COVID is lower than dying of motor vehicle accidents. We have not stopped driving. There are data out there that we need to look at and be very, very careful. thinking there is a chip in there. We don't, even if there is a chip in there, that's fine. I would say just get vaccinated.
Thank you so much, Dr. Waleed Javaid of Mount Sinai. And if you missed any part of this interview, download the iHeartRadio app. It is free, and all of my conversations and interviews live on. The podcast is Sunstein Sessions. And I will see you guys tomorrow morning on the Jim Kerr Rock and Roll Morning Show, Q104.3.
New York's classic rock, Q1043.